Murthy, Consulting Orthopaedic Surgeon practicing in Bangalore. Osteoarthritis is a common problem seen in elderly people all over the world. There is a degeneration of the cartilage in the joints leading to osteoarthritis. Osteoarthritis is seen more commonly after the age of 60 years, more common in women than in men. There is another type of arthritis, osteoarthritis, seen in younger people, which is following disease, injuries, or infection. But today we will be talking about the common osteoarthritis seen in the elderly people. So, first I want to emphasize osteoarthritis is not a disease. It's a normal aging process, normal wear and tear of the cartilage of the joint, which proceeds as the age proceeds. What are the normal symptoms? What the patient complains of? The patient complains of pain, swelling, difficulty in walking, and sometimes sounds in the joints. The common joints involved are knee joint, hip joint, and ankle joint. In other words, it is the weight-bearing large joints that are commonly affected in osteoarthritis. Now, when the patient comes to us with complaints of pain, swelling, difficulty in walking, we have to clinically examine. The examination will reveal there may be swelling of the joint due to fluid or synovial thickening. There may be tenderness, pain. There may be restriction of movements, pain on movements, and there may be instability also. All this without the presence of any constitutional symptoms. Constitutional symptoms means fever, chills, loss of weight, loss of appetite. Why I am mentioning this is many arthritis are associated with constitutional symptoms like rheumatoid arthritis, psoriatic arthritis, gouty arthritis. So we have to be very clear that we are dealing with osteoarthritis, which is not a constitutional disease. It is a local disease due to wear and tear. Once we rule out the other conditions for arthritis, we have done the blood tests, we take x-rays. So confirmation of osteoarthritis by history, clinical examination, and by x-rays, simple x-rays of both the knee joints, AP and lateral view in the standing position. There is no need to go for MRI, CT scan. A good clinical examination x-rays will reveal the osteoarthritis, and most commonly affected in our country is the knee joint. Maybe it is because of our squatting and sitting on the floor habits. Once we diagnose clinically and radiologically osteoarthritis, the next question and the most important question the patient will ask is, what is the treatment and what is the prognosis? Prognosis means how will it proceed? Osteoarthritis, being a disease of aging, cannot be cured. It can be controlled comfortably, provided patient comes early and patient is compliant. Compliant in the sense, follows the instructions of the doctors properly. So the treatment will start first and foremost if the patient is overweight, weight reduction. Because more weight means more load on the joints, which leads to more wear and tear. You can compare it to a tire of a vehicle. The more you use it, the more it wears out. Similarly, the joints also wear out with use and increased weight. Lifestyle modifications. That means patient has to change his lifestyle. Activities like squatting, climbing, mountaineering, sitting on the floor, climbing stairs, all this will have to be reduced if not stopped. So this is a part and parcel of the treatment. Simple but difficult to follow at times. Then sometimes we give the patient walking aids. Elderly people, we give walking stick so that the weight load will be transferred to the upper limb, bypassing the diseased joints. Then we have what is known as analgesics, tablets, and non-steroidal anti-inflammatory drugs. But a caution I want to add is, this should not be misused. The more NSAIDs we give, we have seen many patients landing up with kidney and renal problems and gastrointestinal ulcers. So we have to be careful. So more than NSAIDs, which should be used only for a short time, we will depend more on physiotherapy and exercises. You have to give physiotherapy to relieve the pain, ultrasonic massage, IFT, SWD, and exercises are most important. We have to strengthen the quadriceps. We have to strengthen the hamstrings so that the pillars of the joint are strong, reducing the load on the diseased bones. So once that is over and patient improves, you have to follow up with that. But if this does not help, after 6 to 12 months, we have to try this. And if the disease progresses or is an advanced stage of osteoarthritis, then we go for what we call injection therapy. Injection to joints like steroid injection, hyaluronic acid, platelet-rich plasma, stem cells. These are all the new things which we are giving, which can be also used, but only by orthopedic surgeons. Cannot be given by non-orthopedic surgeons. So many patients get help. If you don't get help with this also, then the last resort, I please want to emphasize, last resort is surgery. Either a debridement or an osteotomy or a partial joint replacement or a total joint replacement. Total joint replacement gives good results, but patient has to be very compliant and well counseled, because no artificial joint can replace the God-given joint. So we have to be careful even if we undergo the TKR, but many patients benefit with the total knee replacement if indicated.